Get that children, have feelings. Now we know that children can also become depressed and anxious.
Yes.
And children usually do express depression and anxiety differently than adults do. In fact, their depression is more likely to be agitated, where they're yelling and very grumpy and don't want to be bothered and leave me alone, that kind of things.
Right, right, right. And then there's also instances where children have actually been sexually abused. And of course, this would, I'm sure, cause some behavioral problems, acting out, because it seems like they would not know how to, come to their parents. In some cases, they wouldn't feel comfortable, or
Hmm.
this could be quite problematic, I would expect, wouldn't you?
Yes, I mean, but all of these things are all problems and traumas that happen. Hopefully, not as often,
Right.
but they are things that can be treated with talk therapy and with professional intervention when necessary. And the the goal of the parent is to make your environment such that your child can tell you anything that may be happening to them. And if you've been able to accomplish that goal, then you are an excellent parent.
Right. Okay. Well, this concludes part one of this episode. We're going to just pause for a few seconds, and then we're going to jump right in back into part two of Partners in Health and Biz: Why Your Intelligent Child Often Misbehaves. Okay, so Dr. Fearing, how should a parent approach their child's teacher, for example, for help, if they feel like, well, maybe I need to contact my child's teacher, go in and speak to her,
Hmm.
and find out if there is something going on in school for the middle school child or the high school child? How should a parent approach their child's teacher for help?
Well, if if your child is having a particular problem in that teacher's class, you can start by saying that that your child is attending school every day, and they are coming home asking quite a few questions in this particular class, and you wonder if they may be needing some more help. Um, and you can also remind them of how they've done in this type of class in the past,
Okay.
and what kinds of things have helped the child learn in that class in the past.
Mhm.
Especially if you know the child was struggling until they started letting the child sit in the front of the class, or
Okay.
if they've ever had any type of special, they call it a 504 plan, where the child, sits in the front of the class, gets more time on tests, or needs to be in a quiet room when they're taking tests. They may be sensitive to loud noises and other children moving around, and that may be distracting for them. So
Okay.
letting the teacher know what's helped your child learn in the past can be helpful.
Hmm.
And also, you may want to let them know, listen, my child has been going through some changes lately because uh, you know our the her, the parents are our family is being split up.
Okay.
We're
right.
divorcing, but the father lives close by and will be, you know, will be also involved in his care, but we're very close, and you know, just let them know
Right.
because they're teachers. They've seen just about everything.
Exactly.
You know, they've seen
Right.
children go into foster care. You know, they've seen children have to move and live with a different family, so they understand.
Mhm.
Um,
Right, right. Yes, and many times the teacher will reach out to the parent when they notice behavior that maybe all of a sudden has changed when your child may normally be an A student and answering questions and participating in class, and then all of a sudden they become introverted and shy and starting fights or something in school, and the teacher will reach out to the parent and let them know, which that is a good thing because a lot of times some parents are not as involved with the parent teacher participation as they should be, and it's a good thing if the teachers do and the parents do. They both communicate to help the child. So, Dr. Fearing, what are some of the symptoms that may indicate that a child may have abandonment, fears, and issues? Because you and I had discussed this earlier in a conversation about young children that when they're dropped off, for instance, at their grandparents' homes, and they just really have a crying fit and they just are crying and just saying they want mommy. I want mommy. I want mommy. Or I want daddy. And they love their grandparents and they've been
mhm,
there and they have a great time when they're with the grandparents. But when
mhm,
the parents drop them off, this is
mhm,
a really fiasco kind of
mhm.
crazy type of thing with them crying and screaming and
Uh,
so so
right.
is this does this indicate some type of a abandonment, fear issue?
It's basically I wouldn't even call it abandonment. I would just say that sometimes children have some trouble with transitions, like
Okay.
going from home to school, or going from school back home,
Mm,
or going from the grandparents' house back home to the mom's house or the father's house. And um, that's normal, part of development, but teaching your child how to handle those transitions is um is part of the responsibility of parenting,
okay.
and talking with family members that they may be transitioning back and forth with, and reminding children that that they're going to get more attention if they
Mhm.
don't do those behaviors. if they
Okay.
if they're able to get through, if you're able to, when I take you over to grandmom's house, grandmom and granddad, when I take you over there, um now how are you going to act? You're gonna go in, or you're gonna be screaming and yelling and saying you want this and you want that and you want to see the TV, and no, you're not gonna be doing any of that. You're gonna go in and sit down, and um you're gonna talk to your grandparents about how you've been doing
Okay. All
and
right.
what
All
you've
right.
been doing this week.
Mhm.
And then we have a list of things, activities that you're going to look forward to, and so you'll be talking about what you're going to be doing the rest of the weekend.
Okay. I like that. I like that. Very good. Thank you. And so, Dr. Fearing, what are some of the symptoms oh, actually, what is permissive parenting? That's come up a couple of times,
Okay.
and we just want to know, what is permissive parenting? What does
Okay.
that mean?
Permissive parenting. Okay. Now, permissive parenting is a type of parenting that sometimes it has its good points and its bad points.
Okay.
And there's no one way to successfully parent a child. Um, and, some children can do well with any of these types of parenting. Um, However, permissive parenting is when parents are warm and nurturing, but they have very low expectations for their children. They don't have many rules, they don't have many opportunities to monitor and watch what the child's doing. For example, a permissive parent might might pick the child up from school, give them a hug, and tell them how great they are. And then when it comes to homework, they might say, "Oh, well, you can figure that out on your own. I'll be over here watching TV."
Mm.
Or or when they start having problems at school, they might say, "Well, what do you think you should do?" You know?
Okay. Okay. Or, you don't want to go to school today? Okay, that's fine. Stay home.
Right, right. So it and particularly in the culture, the African American culture, the best form of parenting is not permissive parenting. It's authoritative parenting. And authoritative parenting is really, in general, for most cultures, is the best type of parenting in terms of the relationship with the children is very close. The relationship, that the parents have with the children is close, and there are clear guidelines and expectations. In other words, there are clear rules, things you can and things you cannot do.
Okay.
And discipline is used more as a support rather than a form of punishment.
Okay.
So, and we'll talk about that in a minute when we talk about how parents can can feed into the behavior of the child. But the children, and studies have shown this, the children of authoritative parents grow up confident, responsible, and able to self-regulate.
Mm.
So they're able to handle their emotions and cope with strong emotions.